going to be the nurse practitioner doing your wellness exam today. I'm basically going to be taking a look and listen and testing different parts of your body.
Okay.
Okay, do you have any questions before we get started?
Nope.
Okay. First, I'm going to palpate your blood pressure in your left arm. Sorry, my hands are cold. Okay, go ahead and relax. Okay. I'm going to auscultate the blood pressure. (110/58). And then we're going to compare on the left or right side. (108/52). Perfect. Okay, so now I'm going to have you sit up. And while I was taking the blood pressure, I was noting patient's general appearance, dressed for occasion, appears to be stated age, and appropriate weight. Now I'm going to palpate the radial pulses, 2+ and regular, and we're going to get the rate. Okay, rate is 62, and also while obtaining the pulse, looking at respirations, there's 16 even and unlabored. Okay, now we're going to start with your head. Head appears to be normocephalic. Now we're going to palpate any tenderness or pain. Okay, hair's evenly distributed. It's nice and strongly connected to the scalp. Now we're going to move on to the face. Face is nice and natural in color. No lesions noted. Nice smooth contour. Next, we're going to test cranial nerve 7, the facial nerve. I'm going to have you smile and puff your cheeks and raise your eyebrows. Okay, good. I'm going to have you close your eyes and don't let me open them. Okay, good. Cranial nerve 7 is intact. Now we're going to move on and inspect the eyes. Both globes are present in the orbits. Eyelashes, upper eyelashes are curling upward, lower lashes curling downward. Sclera is nice and white. Conjunctiva is transparent. Cornea is clear. Irises are brown. Contacts noted bilaterally. I'm going to pull down on the lower lids. Good, nice and pink and moist. Noting a few blood vessels in each eye. Anterior chamber is nice and clear. And then I'm going to put some gloves on. And we're going to palpate the lacrimal ducts. Any blockage, no blockage noted. Now we're going to test vision. So I'm going to have you hold this about how you would read a newspaper and cover your left eye and read the lowest line for me.
LTFPH.
Good. 20/20 vision in the right eye and cover your right eye and read with your left.
LTFPH.
Good. 20/20 vision in the left eye. Now we're going to test visual fields. So I'm going to have you cover your left eye and tell me how many fingers I'm holding up.
2. 1, 4, 3, 5.
Okay, and our opposite eye?
1, 2, 3, 4.
Okay, good. Now we're going to test the 6 cardinal fields of gaze. And while I was doing the visual acuity with the Snellen chart, I was testing cranial nerve 2. So now just follow my finger with just your eyes only. bring my finger towards the midline. Good, convergence noted. And that was a test of cranial nerves 3, 4, and 6. Now we're going to test for making sure that your eyes are symmetrical. So I'm going to shine this light in both your eyes. The light shines in the center of each eye. They're nice and symmetrical. Now we're going to test direct and consensual light. Left pupil constricts. Right pupil constricts. Right pupil constricts. And left pupil constricts. Now we're going to check the size of the pupils. It's to be about a 5 in both eyes. Okay, good. Now we are going to perform the ophthalmoscope exam. So we're going to turn the light on, make sure our diopter is set to 0. And with my left eye, I'm going to focus on his left eye and note the red reflex. And then with my right eye, I'm going to look in his right eye and note the red reflex. Now we're going to set the diopter to 10. And we're going to focus in closer, going through the cornea, noting the optic disc, physiologic cup, the veins and arteries, and finally the retina. Now take a look at me, and the macula is noted. Perfect. Now we're going to take the diopter back to 10, and we're going to examine the left eye, going through the cornea and the lens, noting the optic disc and physiologic cup, our veins and artery, and the retina, and look at the light and the macula. Perfect. Okay. So now we're going to turn the light off. Next, we're going to take a look at the nose. It's nice and midline. I'm going to palpate any of that tender. No deformity noted. I'm going to palpate your facial sinuses, any tenderness, and maxillary, any tenderness. Okay, next we're going to take a look up inside the nose. Turn our light on. I'm going to have you tilt your head up. Take a look. Nothing is obstructing the nares. Septum isn't deviated. Nasal hair is nicely distributed. I don't see any polyps on the turbinates and no swelling noted in the turbinates and no drainage. Next, we're going to test cranial nerve 1 and your nair patency. I'm going to have you close your eyes and occlude one of your nostrils and sniff and tell me what that is.
Coffee.
Okay, and then occlude the other nostril and tell me what this is.
Vinegar.
Okay, perfect. Okay. And now we're also going to test cranial nerve 5. So I'm going to have you clench your teeth. Perfect, that's motor. Then I'm going to have you close your eyes. And tell me when you feel something touching your face and what side.
Left. Forehead. Chin. Right.
Perfect. And lastly?
Nose.
Okay, good. And we're also going to check the corneal reflex. So open your eyes and this cotton tip's just going to hit your cornea. Patient blinks, it's a normal finding. And patient blinks, that's a normal finding. Okay, now we're going to take a look at your mouth. Lips are nice and symmetric, pink, moist. I don't notice any cracks or ulcers around the lips. Open your mouth, good. Hard and soft palate are intact. No ulcers or lesions noted. Posterior pharynx is nice and intact and pink. Uvula is midline, tonsils grade 0, 32 white straight teeth noted. Gingiva isn't bleeding, nice pink and moist. I'm going to go ahead and have you stick your tongue out. Inspecting the tongue, no ulcers or lesions noted, nice pink and moist. And then I'm going to have you say ah. It's cranial nerve 12, and we're going to elicit the gag reflex. Okay, good. That's cranial nerve 9 and 10. And then I'm also going to have you stick your tongue up and go ah, so I can see the bottom. Good. Wharton's ducts are noted, nice pink and moist. And stick your tongue out again so I can see Stenson's ducts. Okay, good. And then I'm also going to palpate the tongue and palpate the bottom of your mouth. Okay, so lift your tongue up again. Any of that tender? Okay, and then stick your tongue out again. Palpating the sides Any of that tender?
Mm-mm.
Okay. Good, and that concludes our assessment of the mouth. Now we're going to move to the ears. Looking at the ears, nice and normal, no deformities noted, no drainage noted. Any of that tender?
Mm-mm.
Any tragus tender?
Mm-mm.
Okay. Now we're going to look inside the ear. Sometimes this won't stay on there. Okay. With our left ear, we're going to hold the otoscope with our left hand. Internal canal is nice and natural in color. Nothing's obstructing the internal canal. Tympanic membrane is nice pearly gray. Light reflex noted. Okay. And the right side, we're going to pull up and back on the pinna. Internal canal, nice natural in color. No erythema noted. Nothing's obstructing the canal. Tympanic membrane is nice pearly gray. And light reflex is noted. Good. Now we're going to test cranial nerve 8. So tell me which ear you hear me rubbing my fingers on. Close your eyes.
Left.
Okay?
Right.
Good. Okay, now we're going to perform the Ren test. So I'm going to strike this, put it on your mastoid tip, tell me when you stop hearing it, and then I'm going to move it to your ear.
Okay.
Time it. Okay.
Can we do that again?
Can you hear it? Okay.
I can't hear it anymore.
Okay. My watch keeps going off.
Still hear it.
Okay.
No, I don't hear it anymore.
Okay, good. Ear conduction is greater than bone conduction. That's a Ren positive. Now we're going to do it on the right ear.
Okay, I don't hear it anymore.
Okay.
No, I don't hear it.
Okay, good. Ear conduction greater than bone conduction in right ear. That's a Ren positive. Next, we're going to do the Weber test. So I'm going to put this in the middle of your forehead, and you tell me if you hear it greater on left, right, or the same.
Okay. Same.
Okay, good. Okay, and that concludes our test of the ear. Now we're going to move to the neck. The neck is nice and erect in the midline. I don't see any nodules, any like goiters by the thyroid. None of that is noted. Now we're going to palpate the neck. Any pain or tenderness? Okay, and we're going to palpate the thyroid. So just keep leaning forward. I'm going to displace the trachea to the right and swallow. Okay, sorry, I know it's uncomfortable. And then displace the trachea to the left and swallow. Sorry, the thyroid non-palpable. Trachea is nice and midline. Okay, now we're going to palpate the lymph nodes. Occipital, post-auricular, down. I need to take these off. Sorry. Occipital, post-auricular, down to the post-cervical chain, to the deep cervical, superficial, up to the tonsillar, parotid, preauricular, down to the submaxillary or submandibular, and submental. And was any of that tender? Okay, good. No lymph nodes palpable. Next, I'm going to have you take a deep breath. Okay, good. And no supraclavicular lymph nodes palpated. Okay, now shrug your shoulders for me. Okay, and look up. That's a test of cranial nerve 11. So that concludes our test of the neck. Now I'm going to move to the posterior chest. Inspecting the skin on the posterior chest, nice and clear, natural in color, no lesions noted, no nodules noted. Now we're going to palpate the posterior chest. Any pain or tenderness noted?
Mm-mm.
Okay, now we're going to percuss the posterior chest. It's nice and resonant in sound. And here on the right side, it starts to become dull, which we would assume the liver would be. And over here it becomes dull, where we would assume the spleen would be. Next, we're going to check for any costovertebral angle tenderness. Does that hurt?
Mm-mm.
Does that hurt?
Mm-mm.
Okay, good. Next, we're going to check for excursion. So I'm going to have you take a deep breath. Good. And notice how my thumbs rise and fall symmetrically. Next, we are going to look for any tactile fremitus. So when my hand touches your chest, say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. And that sounded the same throughout the entire posterior chest. Next, we're going to auscultate the posterior chest. Deep breath. Good. Lungs are nice and clear. Next, we're going to look for any sacral edema. While we're back here, I'm going to pull your pants down just a little bit. No edema noted. Perfect. Now we're going to move to the anterior chest and back to the skin. Patient's positioning is nice and relaxed. No tripoding noted. Skin is nice and natural in color. No abnormal movements noted. Next, we're going to palpate the anterior chest. Any pain or tenderness noted? Okay, next we're going to palpate the 5 areas of the heart. Apical, pulmonic, Erb's point, tricuspid, and finally our point of maximal impulse, the mitral. Good, nice and regular. Next we're going to listen to the heart with the bell, or the diaphragm and then the bell. And our bell. Good. Nice S1, S2, regular rate, no gallops or murmurs noted. Again, we're going to palpate for any tactile fremitus. So 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. And we can also percuss the anterior chest. Nice and resonant. And we'll also take a listen to the anterior chest. Deep breath. Good. Nice and clear in all lung fields. And we can also check the excursion on the anterior chest as well. So take a deep breath. Good. And my thumbs rise and fall nice and symmetrically. Okay, and lastly, I'm going to have you lean all the way forward so I can listen with the diaphragm. Good. Nice S1, S2, regular rhythm, no murmurs or gallops noted. I'm also going to take a look at your axilla. Okay, here is nice and evenly distributed, both sides. Gonna palpate. Any pain or tenderness? Okay, and no abrasions or lesions noted. Perfect. Now I'm gonna have you lay back. We're going to do an examination of the carotids. First, we want to listen to the carotid arteries with the bell of our stethoscope before we palpate, in case there's a thrombus. Okay, no bruits noted, so we can palpate. Okay, and we could check jugular venous distension with our pin light by having the patient look to the right and shining a light, seeing if we can see it reflected on the sheet, which we do. Good. Okay, next we're going to move on to the breast. Inspecting the breast, they appear to be symmetric, nice and even in size. Gonna palpate. Any pain or tenderness? Okay, and we want to make sure and go over the nipple to make sure there's nothing underneath there, which I don't feel anything. Moving over to the right side. You know if there's any tenderness. Okay, good. And finally going over the nipple. No nodules noted, no tenderness noted. Next, we're going to listen to the heart again while the patient's lying supine. Good. Listen with the bell. Good. A nice S1, S2, regular rate and rhythm, no murmurs or gallops noted. Now we want to look at the heart for any abnormal lifts, which I don't see. We're going to palpate for localized lifts or heaves, and for localized we want to use just our finger pads. And for generalized, we want to use the palm of our hand. Good, no lifts or heaves noted. And lastly, to conclude our exam of the heart, I'm going to listen with the bell and have the patient turn on their left side, listening at that point of maximal impulse. Okay, good. S1, S2, no murmurs or gallops noted. Next, we're going to move on to assess the abdomen. Looking at the abdomen, nice color, natural in color. Looking at the movements, abdomen rises and falls with respirations. I don't note any peristaltic waves. I'm going to have you lay your hands at your side and cough for me. Good, and I don't notice any abdominal hernias. Next, we're going to take a listen to the abdomen. Nice normal active bowel sounds. We're going to listen for any bruits. And we're also going to listen for any bruise in the abdominal aorta area before we palpate. Okay, good. No bruits noted. We're going to palpate the abdominal aorta. Okay, good. And then we're going to do light palpation in all four quadrants, so let me know if any of this hurts. Any tenderness? Okay, and then we're going to do a little deeper palpation. Any tenderness noted? Okay, good. And then we're going to percuss the abdomen, so we can try and find the liver and spleen so we can palpate those two organs. Nice tympanic sound. Go back up. About here is where it gets dull. And right about here is where it gets dull. So these are the two landmarks where we would want to palpate for the liver, which I'm going to do. I'm going to have you take a deep breath in. Okay, good. And you can feel the edge of the liver as he does this. And then I'm going to have you take a deep breath. Okay, and let it out. And the spleen is non-palpable, which is a normal finding. Next, we're going to elicit the superficial abdominal reflex. So you see the umbilicus constrict. Okay, good. And then we're going to palpate for femoral artery. So if you could just pull your shorts down just a little bit, or actually it's easier if you do down. Okay, good. Okay, and then we'll listen for any bruits. Sorry. No bruits noted. Good. You can pull your bottoms up. And lastly, we're going to perform the psoas sign. So I'm going to have you scoot all the way up in the bed and lay down. Okay, and then we're going to slightly flex the patient's leg and then put our hand on the thigh and raise your leg up for me. Any abdominal pain? Okay, good. And then I'm going to have you turn on your left side, okay, as I extend the leg. Any abdominal pain noted? Okay, good. That would be a test for appendicitis. And we're also going to check any rebound tenderness. Did any of that hurt? Okay, good. All right. So moving on with the male genitalia, we're not going to do that on the patient, but we want to inspect the skin and hair distribution, looking for any lesions, any drainage anywhere, any masses. We want to palpate the inguinal area for any hernias. We want to inspect the penis, the shaft, the urethra, and the scrotum and testes. We would want to be looking for any hernias in the scrotum, any pain or tenderness. We would want to be looking for any discharge from the urethra, and we would want to be looking for any tenderness when palpating the penis. The rectal exam, we would want to look at the rectum first, look for any hemorrhoids. We'd want to have the patient strain and look for hemorrhoids. We would want to insert our first digit and note that the anal or the anus constricts around our finger. We'd want to palpate the anal walls for any tenderness or irregularities. We'd want to palpate the prostate, should feel smooth and firm, and we shouldn't note any tenderness from the patient. And finally, removing our finger, we would want to test the stool for a colt. So now I'm going to have you sit up, and we're going to do the neurological exam. So I tested cranial nerve 1 when the patient smelled the coffee and vinegar, cranial nerve 2 with the eye chart, cranial nerves 3, 4, and 6 with the eye exams, cranial nerve 5 was tested with the Q-tip and the patient clenching their jaws, and the 2x2 on the patient's face. Cranial nerve 7, we did the facial when the patient raised eyebrows and smiled. Cranial nerve 8, when the patient listened to my finger rubbing. Cranial nerve 9, 10, and 12 were performed whenever we looked in the patient's mouth and elicited the gag reflex and he stuck his tongue out. And cranial nerve 11 when the patient shrugged his shoulders. So now I'm going to assess, can you tell me your name?
Zachary.
Okay, and where are you?
Perryville, Missouri.
Okay, and what is the date?
April 17th.
Okay, good. Patient is alert and oriented ×3. Next, I'm going to have you stand up, and I'm going to observe your gait. So if you can just walk towards him and walk back. Okay, good, and walk back to me. Good. Gait is nice and steady. Now I'm going to have you do the Romberg exam. So I'm going to put your arms at your sides, and then close your eyes, and we're going to look for any swaying. Okay, good. No swaying noted. Now I'm going to have you sit back on the bed, and we're going to have you do rapid alternating movements where you pat, start slow, and then go fast. Very good. Next, we're going to test light sensation, and I'm going to have you close your eyes and tell me when you feel this on your skin.
Feel it.
Okay, good. And if we weren't able to feel it, we would go up his extremities until he could feel it. Next, we're going to test position. So I'm going to have you hold your fingers out, and I'm going to go down, up, and you tell me which way they're going.
Okay. Up, down. Up, down, up, up.
Good. And with the lower extremities?
Okay. Up, up, down, up, down, down.
Good. And then we're going to test vibration sense. So I'm going to have you hold your finger out. I'm going to strike the fork, and you tell me when you stop feeling this.
Okay. I don't think I feel it.
Okay. Same for me.
Don't feel it.
And lower extremities. Sorry, I'm trying to barely touch it so it goes off.
Don't feel it.
Okay, and last one.
Don't feel it.
Okay, next we're going to do the finger to nose. So I'm going to hold my finger out, you touch my finger, then touch your nose. Perfect. Okay, and then I'm going to have you take your right heel on your left knee and take it all the way down and back up your left leg. Good, and opposite leg. Okay, good. Next we're going to test and see if the patient can feel me touching him in two different body parts. So close your eyes and tell me where I'm touching you.
My cheek, my right cheek, and my left forearm.
Okay?
Left cheek and right forearm. Both forearms.
Okay, good. And then we want to test 2-point discrimination. So I'm going to have a paper clip.